to get settled in, but for now I'm going to jump into it. Good afternoon, folks. My name is Josh Jacobson with Next Stage, a Charlotte-based consulting firm that works with nonprofit organizations. I'm thrilled to be with you for the fourth of 4 webinars. This one entitled Strategic Opportunities, Leveraging the Crisis for Change. Before we move forward, I want to thank our friends from the National Association of Free and Charitable Clinics, as well as the North Carolina Association of Free and Charitable Clinics for making this possible today. As I noted, I'm a consultant based in Charlotte. Here's a little bit about me. I partnered with over 200 nonprofit organizations over the last 10 plus years, working increasingly with clinics and community health organizations. I've grown to have a real deep admiration for free and charitable clinics and the important work that so many of the folks who are on this webinar do for a living, and the passion that you put into your communities. So thank you everyone for the work you do, and thanks for being here today. Some of our core service lines are strategic planning, organizational development, and resource development. We are not health specialists. In fact, we work with all sorts of organizations, and we do that intentionally so that we can learn from each and every different organization about the experience of the nonprofit experience. We are the business underpinnings of the nonprofit experience. You're experts on health. We are experts on the nonprofit as a business model. And that's really what our series has been focused on, is the kind of business side of the free and charitable clinics. As you see on the right-hand side there, I was called to do some work for the North Carolina Association of Free and Charitable Clinics. I was midstream working with 4 rural free and charitable clinics when COVID-19 struck. And working with them, I came to realize the needs that these communities were facing, and thought to create a workbook. So we have a crisis response workbook that was disseminated across the state here in North Carolina, and also up to the National Association. It's a simple workbook, a way to start thinking about COVID-19 and how it might impact some of the underpinnings of your clinic. And that gave birth to this webinar series. So this is the 4th. Here we are, May 1st. Happy May, everyone. We've had 3 other sessions, one on messaging and communications, developing your COVID-19 narrative, financial resources, building your value proposition, and human resources yesterday with April Cook from the Lake Norman Community Health Clinic on sustaining your team. Today we have 2 more panelists that I'll be introducing here in a bit to talk about strategic opportunities, leveraging the crisis for change. And really, this whole series has been about strategic opportunity. In fact, that's been a theme running throughout this, that COVID-19 is actually an opportunity for your clinic. And that may be a hard pill to swallow right now, recognizing that the disruption that has come through COVID-19 and how that's impacted so many safety net organizations, and your clinic, no doubt, amongst them. But I choose to see it the other way, which is COVID-19 is ushering in a tremendous opportunity for clinics to claim a new mantle in their communities, to be thought of as the essential nonprofit organization that it truly is, to maybe shake free that best kept secret moniker that so many of our clinics are challenged with, and instead be thought of as one of the leading nonprofit organizations serving the needs of low-income people in your communities. I believe that's the future. I believe that's going to happen anyways. To the degree that you can control that and move that needle yourself, that's really what this whole series has been about, and certainly today. So I want to talk a little bit about how to do strategic thinking and planning while we are midstream of crisis. Hard to consider. Let's launch a strategic plan. I don't know if any of you have engaged in strategic plans. I do them for a living, and I know the knock on them. They're painful efforts that take months and months to do, and result in paper, a report that maybe isn't implemented. And I hate that for strategic planning, because Really, all this is strategic planning is looking internally, looking externally, making decisions and operationalizing. It is that simple. And I'm going to share with you today some thoughts about how to do on the fly internal and external assessment that can lead to maybe rethinking and thinking about the strategic opportunities that COVID-19 is ushering in. So I'm going to jump into that, talking about the internal assessment. I know for a fact many organizations, including probably your clinics, are thinking this way. Usually our financial position. What will our financial position look like a month from now, 3 months from now? It is really reading tea leaves to better understand how will philanthropy be impacted by COVID-19. What if there is a second or third wave of it? What if there's a continued economic slowdown that further impinges upon our sustainability? We can only guess at that. But what we can do is take stock of our current financial position, how our cash flow looks currently, what future revenue might look like. Certainly, the event that you were planning for next month is probably upended, but there may be other strategies that you had in mind, a grant that you knew was renewing, new grant opportunities. We talked about that as a part of our financial resources webinar, that there may be actually dollars out there that were unavailable to you once upon a time that now may be available to you. So taking stock of potential revenue, thinking about our governance, thinking about our needs on the governance, think about your board. Who would be a good board member for you right now? And how might you both draft new board members, but also on the fly? I know multiple organizations that have lost board members in recent months. Since COVID-19 hit, some board members have just said, sorry, I'm too busy. My business is at stake. I have to show up for my staff. And this is a volunteer effort. I'm not available. How are you going to deal with some of those challenges of governance? This is internal assessment is about taking stock. Think about your current staffing. We talked yesterday about staffing, the importance of staffing and how we take care of our team. What happens if important staff get sick? How will we navigate the sudden loss of maybe some staff members as they may have to quarantine themselves? And then facility. For many of us, that means shutting our facility, closing our doors, having social distancing inside the facility. We have to take a full internal assessment and take stock of where we are. If your board hasn't been asking for that, if you are a founder or executive director, this is a first stop. We need to project kind of where we are now and start thinking about the future. So if I were creating a dashboard, I'd encourage you to look at 3 areas of strength. Of all these considerations, what are strengths right now and what are those challenges? And to place that into a framework that we'll get to in a bit. After our internal assessment is done, we got to start thinking about a needs assessment. I've been talking to a whole bunch of folks who have some pretty amazing stats on where our world is right now, where our country is, where our community is. The amount of unemployment right now is just astronomical. The sorts of numbers that you would expect during the worst of a Great Depression. Now we know that this is a sudden loss of employment for a lot of people. It may be, in fact, recoupable, maybe on the other side of this. But where is the other side of this? And needing to think about how many people are going to be in need in the next month, 3 months, 6 months. We have to start somewhere. So I would start with our health assessment. That's probably our, if we have a county health assessment or some formal health assessment as a means to, where were we in the most recent year? Where were we when this was last conducted? And now we're going to have to compare that with trend line that we're going to talk about in a bit. Looking at social determinants, what are those impacts that are likely to impact negatively somebody who is suddenly without work, without access to healthcare? And then look at our demographics. What's changed recently? Some of this stuff is what you would do during a traditional strategic planning process. That needs assessment right now is really a function of understanding where were we, what was the benchmarks that were normal just 3 months ago, and how will trend, as we'll see in a second, start to inform that. So our dashboard, we'd probably start looking at what are 3 needs that are being met and where are 3 opportunities? Where could we be thinking? And I know that may seem strange to even be thinking right now that there is growth opportunity for your clinic, but I'm here to tell you there is. I see it every day with the organizations that I've been working with that are thoughtfully partnering and collaborating and repositioning at a time when the lens of the world is on community health. I mean, this is really our calling. This is our time. There's never been a better time to be channeling a message. So our dashboard here would be looking at a needs assessment. We'd also be looking at comparative research. We'd probably be looking at other clinics. A webinar like this is helpful because we're able to bring forward some panelists who can share a little bit of what's happening in their world. But look at the clinics in your own community, other free and charitable clinics, maybe some FQHCs, looking at what the health systems are doing. You know, there's a challenge right now in a lot of health systems. It's kind of a both and. We have both frontline essential nurses and physicians that are challenged by COVID-19. We also have some physicians that have had to stop their elective surgeries, stop seeing as many patients. The challenge to your health system may be in how generous they might be to your clinic in the future. How are you starting to think through their needs as you are pondering your own organization? And certainly human service agencies in your community, your referrer partners. How are you engaging with them? When was the last time you had a peer-to-peer conversation with one of those social determinant partners potential across the street? Yesterday we talked about board members and board chairs getting together. Could your board chair call the board chair of another organization in your area just to talk about what they're seeing and what alliance there could be or overlap there could be? Certainly we need to be doing comparative research. And I would hope that would come up with who are your core partners, but also where are the potential partners? Where is the potential in COVID-19 to forge new relationships? Again, I see a lot of headline grabbing being done more by the sheltering in place and the economic challenge than I do from nonprofits talking about the health needs. It's certainly wall to wall on our news programs. When I look at the nonprofits that are doing the best job of putting their organization in front of people, it's going to be those food banks. It's going to be the shelter organizations. I'm seeing a lot of very concentrated messaging there. How are we partnering with them? Because frankly, they are larger and have more resources. How are we becoming more a part of the fabric of crisis response in our communities? Lastly, trend research, and this really hits across all of it. How would we be looking at the various trends that are in our communities? And some of the rural clinics I'm working with right now, a huge number of local small businesses are just in a horrible way right now. What is the mix of businesses in your community? Where are the injuries? Where is the potential? There are some companies that are doing just fine, and others that are even doing better. There are also those that are not doing very well, probably more of those. How are you taking stock of that in your own donor base, in your own sponsorship? Thinking about philanthropy. Now is a good time to be asking foundations for support. I'll tell you why. Foundations use a 3-year rolling average when determining how much they are going to grant each year. And so that is meant to ensure that no boom and bust year would grow the amount of giving that they could give in any one year. It's meant to stabilize. So as we use 2019 final year financial positioning, it was an extraordinary year. It's hard to think that now. Here it is May 1 and our stock market has taken a big hit, but on December 31st, it was an amazing year, amazing up year. So what that means is they use 2017, 2018, and 2019 to determine how much they're going to grant in 2020. So we have this extraordinary year. In fact, we dropped a year in 2016. That was an okay year for a really great year, which means that there's more dollars actually in foundations this year for giving than in any of the past 5 years. How are we capitalizing on that? that's a trend that I am sharing with you now, but is directly impacting organizations in your community, because they're putting a need on that and putting that in front of area philanthropy. Real estate. How is the real estate market in your community? How are the individuals who are landowners in your small, large cities? How are they feeling the impact of this? Generational. In our own Charlotte here, we have a really growing millennial audience of folks who are relocating for our banks and for our opportunity. And many of them are in a tough bind right now, without a lot of dollars to sustain them, potentially furloughed until further notice. How are your young people? Because that's really the backdrop of your case for support. That's the backdrop of the work that you're doing, is what's happening in your community. So I would use some of that data and trend analysis, and really your local newspaper is one of the great places to go, or if you have a business journal or any sort of business periodical to check into. Even having some conversations, a couple interviews with some key people could give you some data points, which are supportive of you as an organization, which are actually trending for you in the upward direction. And then what are 3 disruptive data points? Let's bring that all together. And, I would compile this research, and I think it should be written down. This is something that anybody on this webinar could do in a couple weeks. By mid-May, you could have a grid of 3 strengths, 3 challenges, 3 strong partners, 3 potential partners, 3 needs that you're currently meeting, and 3 potential opportunities to meet needs that you're not currently meeting, 3 supportive data points, and 3 disruptive data points. And what I do is bring our board together and say, guys, I know it's a tough time, but it is going to be vision that is going to raise money. It is going to be vision that gets people excited. It's going to be us casting who we want to be coming out of COVID-19. If we go back to being the best kept secret in our communities, we have made a gross miscalculation of the opportunity. Because when has there been a better time with flattening the curve, and when thinking about who is next to you at the supermarket having a direct impact on your health, your personal health? It's a self-interested time. I give to my local small free and charitable clinic because I care about my own health. It's a great and tremendous time. How do we leverage that? How do we move into new places for our clinics? Well, that's why we got some experts here. I'm going to share them and bring them forward. I want to thank Stephanie Garris and Linda Judah for joining us. Stephanie from Grace Medical Home in Orlando, Florida, and Linda from the Social Welfare Board in St. Joseph, Missouri. Thank you both for being here. I'm going to take you both off mute. Stephanie, I think you're a little sideways. You might flip your phone. I don't know if that would help. There we go.
Is that better?
It's perfect. Thanks so much. Guys, thank you for joining us today for this our last topic. We had a great conversation a week or so ago, and I want to just jump right into it with Stephanie. And I hope you'll maybe share a little bit of who you are and a little bit about your clinic. But we asked you a direct question of, what has COVID-19 revealed in terms of local community health coordination, and how can free and charitable clinics help to drive a conversation regarding greater coordination? So love to turn it over to you and just have you maybe comment on that a little bit and share a little bit about your clinic.
Sure. Thanks, Josh. I appreciate it. Nice to be with my colleagues from around the country. I love the work that free and charitable clinics do, and I think free and charitable clinic people are the absolute best. So I commend you for the work that you're doing in your community. My clinic is in Orlando, Florida. It's a large charitable clinic, and we have a lot of retirees who serve in our clinic. Our particular model has, I do have some staff physicians, and then we supplement with our specialist volunteers or primary care regular volunteers. So it's large. We also have a dental center, and we do wraparound services and social services. And what this pandemic has revealed to me and to us is how, frankly, how the hospitals see us. In my community, we have 2 large not-for-profit hospital systems. And when this started unfolding at a very high level, both hospital systems called me and said, what do you need to stay open? Because they were worried that they were going to get inundated. There was a lot of concern in Orlando, given our international tourists, that we were going to be overrun, and they wanted us to be open. And this was very early on. We're talking, the early part of March. What do you need to stay open? What can we give you? How can we support you? And one of the hospital systems immediately established a process to use their labs for COVID testing, where our medical director can write the prescription. And we immediately had access to testing, which way back then was really hard to get. So it's revealed to me that our hospital systems know who we serve, know our role, and wanted to make sure that we are open and still seeing our patient load.
Mm-hmm. That's good. I wonder if what sort of conversations you've had with different folks. The hospital systems. Have you had much interaction with other human service agencies during this time?
Yeah, we have, and that was another really wonderful opportunity. We already had a relationship with our local food bank. We developed it years ago. And if you don't have a relationship with your local food bank, reach out to them. Now is a perfect time, because food banks are trying to make the connection with food and health. And certainly we're doing exactly that in our clinics as well. And that's a national movement. So if you don't have a relationship with them, call them now. Because we did have a relationship, we had access to healthy food boxes to distribute to some of our patients that's grant funded. Well, when this all started happening, they knew that we had a distribution mechanism and that our patients were the neediest, the most in need in our community. And so they called us and said, hey, if we give you extra boxes for free, because we need to immediately, get this food out there, can you take them? And we jumped every chance we can get. Every Monday, we find out their availability of having extra boxes. And for the last 6 or 7 weeks, we typically get as few as 8 extra boxes, 8 to 10, or as many as 80 extra boxes.
Wow.
Well, what that allows us to do is then change the patient appointment. So now our doctors are dropping off the food boxes to our patients' home and maybe checking in on them, maybe dropping off medications if they had to do that. And our patients are so grateful. I've delivered food boxes, and I'm not a clinician, and it was one of the most rewarding things that I've done. So it's been remarkable.
That's great. It's so wonderful when you do have a good working relationship. I often ask, do you know these people? And sure, we might know them, but having a trusted working relationship so that you're just a phone call away. Sounds like you have that there at Grace Medical. I wonder about innovation. You note sort of innovating about how medical care and new approaches are maybe one of the opportunities in the community health coordination. Can you speak to that a little bit?
Yeah, and I touched on it briefly. All of my staff doctors have now done home visits, and they've been able to drop off the box. But what that also does is it allows the provider to see the home needs and what that looks like and where the patient is living, because that might explain a lot of other medical conditions. We certainly we already had telehealth, and we flipped that switch very quickly to what the visit looks like and how it looks different. And now our volunteer doctors really want to come back, but for some of them, because of their age, it's just, we're not going to let them come back. What we are doing is now giving them a computer, letting them check out a computer and do specialty clinics from their home, and they're thrilled.
Yeah, it's wonderful. Telemedicine, telehealth has come up in literally all of these sessions, and what a amazing opportunity that's been for clinics to innovate. Well,
Yep.
Stephanie, thank you. I'm going to move on to Linda. Linda, thank you for being here with us. And
You're very welcome.
I posed a question to you. Can we leverage these trusted relationships to be more proactive, to be a conduit, to be really thought of as the quarterback, if you will, of the people we serve? And I wonder how you feel about that question, and maybe tell us a little bit about the Social Welfare Board.
Sure. Well, first of all, thank you, Josh, for asking me to be part of this conversation. I echo what Stephanie said, and I'm thrilled to be communicating with all of our colleagues this afternoon, and hope you all are doing well. So I'm basing my answer on the experience that I've had with the Social Welfare Board over the course of the past 14 years. The Social Welfare Board is a free and charitable clinic. We were created by state statute back in 1913. So I believe we're officially the oldest free clinic in the United States, but our governing model, like I said, was created by a state statute. So we predate 501c3 laws, and that sort of three has caused issues. For example, the payroll protection money, we did not qualify because we didn't have a formalized 501c3. Through the Social Welfare Board, we provide medical, dental, and women's health services. We have about a little over 5,000 patients we serve annually. We have a full dispensary. We collaborate. We started this community health worker program about 5 years ago. So we collaborate with the local community action partnership group, and they have, we turned that program over to them about 2 years ago because of funding, but now they have planted a community health worker at our clinic. So, we have a lot of collaboration going on already within the community. But so to answer your question, it's yes. By the time our patients access services, they typically have experienced so many hardships, losses concerning income, their healthcare issues, diminished health. And so they come to us in a very vulnerable state. However, they're met with a lot of compassion and mission-minded staff. And so trust is built and people are served. So we have a proven record, just like all of the other free clinics across the United States. And we're advocates for our patients. And we really become subject matter experts for their disease processes, for whatever social determinants that they might be experiencing that's impacting their health. And so educating patients about COVID is just really another example as to how we free and charitable clinics can help our patients navigate health and safety. They trust us.
Yep.
But that trust moves beyond the patient, and as Steph alluded to this, but it's out into the community. So it's important that we remain relevant as clinics. And we do that by collaborating and with our stakeholders and coordinating the care of our patients with those stakeholders.
Yeah, so good. Well stated. And I know as so many clinics are thinking about, and the trend in philanthropy is towards the social determinants of health, how critical what's happening in the non-clinical context is to the health of someone. Would suggest that, sorry, go ahead.
Oh, well, I wanted to also highlight this platform that we have embedded with our community health worker program. And it really tracks the referrals that are being made amongst all of the community groups, the social service agencies within our community. And so it holds people accountable who's accepting that referral. And we can track as to what services that particular patient has accessed. And it creates like a longitudinal type line for us. So eventually we'll be able to capture additional funding and that sort of thing for the special needs.
Well, there's never been a better time, a confluence of things, data finally catching up, a COVID-19 really highlighting our challenges. As I was saying, the sort of social determinants suggests, a non-clinical impact and maybe suggests, health being owned by, multiple different types of organizations. But the reality is, you're exactly right, that trust that's formed, that is the essential ingredient. The essential ingredient in the free and charitable clinics is the care and the time spent to build those relationships. And so I wonder if there's not an opportunity for us to really leverage that, for that to become something that is almost a brand signifier. From a strategic standpoint, what do we do with that? So if we believe that's true, what do we do? How might we move the needle in our own communities for understanding and appreciation of this important role that clinics play? Linda,
Well,
what are your thoughts on that?
Well, honestly, from my perspective, I mean, this whole COVID-19, it really just has enhanced our credibility. You know, for a long time, our clinics have learned firsthand from patients the numerous issues that keep them in a cycle of poverty. They're all influenced by various social determinants of health. So really, I think this pandemic is exposing the vulnerabilities of our neighborhoods and communities. And I think it really confirms our messaging that the need of our existence is just so vital. And, you know, communities are realizing health is a right, and we as free clinics can be relevant to that.
Mm-hmm. So true.
As we know, poverty and the impact on health are forever linked.
They're forever linked. Yeah, we basically have a billboard for that happening in every town across America. Yeah. Well, thank you both. I'm going to bring you back here in a bit because I'm going to encourage folks to jump on our chat. And if you have any questions for our panelists or for me, if you go to the chat function and you can ask some questions, and we'll get to that as a part of Q&A in a bit. Before I do that, I want to bring my folks back. I forgot about this slide. Don't go away. How could COVID-19 change the value proposition? So I think we've touched on it a little bit, but is there anything more to say about the value proposition for clinics and how this might move the needle? I think we were just saying that, Linda, but Stephanie, would you add anything to that?
Well, I would agree that there's tremendous opportunity to change the value proposition. I think the work that our National Association has done up in Washington in this discussion, we're at the table. They understand the role that we play. It's been remarkable what the staff has been accomplished, and that we are now eligible to apply for some of these grants. So I think the value proposition is absolutely tremendous, and we have an opportunity to continue building on that and talking about how Linda's exactly right about how our patients are bearing the brunt of the pandemic, and how you know, some patients, some of our immigrant patients don't qualify for the $1,200 check. What are they doing? What's happening with them? And it allows us to change the entire narrative of who we serve and why we're important.
Yeah, I wonder about the healthcare being linked to one's employment and what, you know, massive unemployment might do to shift the conversation a little bit too. Well, Linda, would you add any more to what you've said? You've already shared such good content.
Well, you know, I would just like to add to what Steph said, that, you know, really puts like an exclamation point on free and charitable clinics work. You know, I mean, yep. We're there, we're doing it.
You're doing it. And I love that. The exclamation point. That may be what we need to start thinking about, is how do we channel that in our own communities? You know, it's great that we have our state association and our national associations that are doing those, but we are all independent nonprofit organizations. You know, how do we channel that message? How do we get others to see what we see in our own clinic? So, okay, now I'm going to hide the video panel, and I'm going to urge people to add any questions you might have to the chat window. And we will address those in a bit, but I want to cover a little bit of what was in the crisis response workbook that was distributed. And at the end of this presentation, I'll share my email address if you do want a copy of that. It's a simple document. It's really more of a chance to have a guided discussion about some of the things that we've been talking about through this webinar series. You know, greater coordination, the silos of programming that we find in our communities. You know, this is a central angst point for our institutional philanthropists. they want to see us do a better job of collaboration and coordination. And I think it's wonderful to hear that, data is making that possible, and, already existing relationships are making that possible. But I'm seeing in other communities, best practice not being followed, where there are silos and ultimately the challenges that maybe have come in the past of trying to collaborate and being shot down, or egos getting in the way of two great organizations working together. But the need is so extraordinary right now. And I think everything we're hearing from our panelists and from the community at large is it's our time. It's our time to step forward. Free and charitable clinics serve a constituency who are at the center of this public health crisis. It is absolutely in the heart of the story. And now might be a better time, the right time, to build those stronger connections with peer organizations. Is it possible to convene the public health department, hospital, and other human service agencies to discuss a coordinated response? If you're not at the table, you need to be at the table in your own community. It's wonderful that that's happening at the national and state level. And I know in North Carolina, there's been some significant successes had by the North Carolina Association of Free and Charitable Clinics with their rapid deployment of telehealth. But I'm seeing down in the suburban and rural communities, maybe less of a proactive stance. And it might be that it's your job to contact the health department. It's your job to connect with the hospital. It's great that they may reach out to you, but if we don't already have that strong relationship, we have to be the ones willing to make that and forge that. Can your clinic aid the local hospital by fielding non-emergency medical needs, thinning wait times in the emergency room? I think we heard that today, that's absolutely what your hospital should be thinking. But if we don't already have a strong relationship, and if that hasn't been nurtured over time, if that isn't a value kind of from felt inside the hospital system, now is the time to step forward and ensure that your hospital system knows what a partner you want to be and can be to them. And is there a prevention role your clinic could play through a communication effort to your patient community regarding sheltering in place, washing hands, et cetera? We were talking yesterday with April Cook about, having contacted, gone through the Rolodex and reached out not only to share her message, which was that they were closing their doors for no admittance. They were allowing telemedicine and drive-bys, but they were communicating a message, but they were also checking in on people and making sure that there was a clear understanding of what's happening, the social emotional needs of our patients. So now is the time to get proactive, not just wait for folks to come through the door, but to actually reach into the communities that you serve, and to do that in a coordinated way with your local community. I hope that there are some new relationships and new ways of working that emerge out of necessity. Necessity is the mother of invention, and I think we need to get there with some new and different ways of working. Brand development. So we talked about this as a part of marketing and communication. That the public health crisis frames the importance of free and charitable clinics. Individuals without access to care can spread a virus like COVID-19, and so we talked as a part of the messaging discussion and fundraising discussion. You have two different audiences out there. You might have a social justice, health justice millennial who feels deeply the sorrow of what low-income people and now increasingly more out-of-work people are feeling in neighborhoods across their city or town. But there's also the fearful, maybe older boomer living in a retirement facility, living in a country club, who can also now capture an understanding of public health. That person can grasp how your clinic is helping flatten the curve by being a good, responsive referrer, but also making sure that the emergency room is free and clear, so that people who really need help can get the help that they need. So thinking about flattening the curve, I'd argue you've been flattening the curve for decades. In fact, if you want to brand that and use that in messaging, I would urge you to do it. We've been flattening the curve since we were founded. That's a new term for a lot of people, but every year the flu comes to our communities. Every year there are seasonal allergies and seasonal viruses and bacterial things we need to overcome, and that you've been overcoming that and helping to flatten the curve. I think that needs to be conceptualized. I think that needs to be something that we stand behind. That's going to be a legacy. We are going to have flattening the curve as a legacy of the first half of 2020, if not the second half as well. With so many people unemployed in the months to come, how will the demographics of who you serve change? Who is going to be a potential customer? You know, there was a time before values-based health back in the day where we used to talk about the working poor, and we used to talk about, you know, the challenge of somebody who doesn't have health insurance, someone who looks like you, donor, someone who has a similar, you know, one check away from being in need, and we're there again, rapidly. It feels like the recession was, you know, a long time ago, but gosh, in very quick form, here we are. How has that changed the face of the people you serve? And what human-centered stories can your clinic tell, framed against the backdrop of COVID-19? If we're talking strategy, we got to be talking about how we get folks to feel our mission, feel the connection. And that's going to be through the stories that we can tell. I'm going to open it up for a little Q&A, bring back our panel. Anybody have any questions in the chat? Anything you want to know of our group here? It's okay if you don't. Maybe I'll ask, what's the one thing that you're, from a strategic standpoint, we talked earlier about strategic planning and kind of doing one on the fly, kind of assessing both internally, externally, and maybe coming up with some action steps as you look to the months to come. For both of you, you know, what are some forward-looking activities that you're planning to do that may be strategic in nature, things you've maybe been thinking about that have emerged coming out of this COVID-19 time? Stephanie, anything come to mind of kind of new strategies you might be undertaking in the rest of 2020?
Yeah, so with this enhanced partnership with our local food bank, we have been thinking about becoming a food pantry, a closed food pantry, to be available just for our patients and have that resource. And ironically, in February, I started our new strategic planning process with our board. It got interrupted. We were supposed to vote on it in April, a new strategic plan. But one of the recommendations was to actually become a closed pantry for our patients because of the linkage between food and health. Well, now because of all that's happened and an even strengthened partnership with our food bank, some funding has become available, and we're actually writing that into our funding, and that's expedited that strategic conversation. And if we get the funding, I think it will happen very, very quickly.
That's wonderful. Something that was on your list, something that was in your strategic plan, that maybe this crisis response, if there's any sort of critical need funds in various communities, that might be an opportunity for you to actually enact something that would have been on the, you know, kind of list of strategic topics anyhow, but to use those dollars that are becoming available. That's wonderful, Stephanie. How about you, Linda? Any kind of new strategies or programs you're pondering for the rest of the year?
Well, a couple of things that I had planned, which now COVID is just going to change the talking points, but we are beginning a speakers bureau. A couple of my board members, myself, are going to be reaching out to various service groups and just telling our story. But now we'll be able to really talk about how we were able to intervene with COVID with regard to our patients. So that'll be part of the story. And then I've also been working with this person through Friends of the Free Clinic for marketing. And we had to put that on hold, but we're going to do a social media marketing campaign as well. So again, just telling our story and reframing our story, and in hopes to generate other interest. So that's from like the community patient segue. Then also, we are going to just keep growing the community health worker program. And as I mentioned earlier, it's tied together with this platform, this referral platform. And so anyway, we're just going to grow that.
That's excellent. And I would urge you, even during this kind of sheltering in place or stay-at-home orders, plenty of chambers of commerce and Rotary clubs and faith institutions are doing a lot of things via Zoom. I had never done anything. This is I first heard of Zoom 2 months ago, and now I literally live on Zoom. But we've done a ton of webinars, and I love the idea of implementing a speakers bureau in a virtual sense, because there are so many places that are just looking for content. And I would imagine hearing from your free and charitable clinic right now would be a timely speaker for most of our clubs and organizations. So what a good idea to be implementing that. We had a question from the group here. With the great pressure of the moment, how are you finding the time to think strategically as a clinic leader? Just, do you have a moment's peace? I'm on Zoom all day. I don't know about you, but do you have some reflective time where you can be thoughtful? Linda, we'll stay with you on that question.
Well, about a year ago, I actually moved to Kansas City, and so that's about a 40-minute commute for me.
Okay.
It's been a blessing because I really have been able to have some drive time and think time.
Yeah.
So I really process out a lot during that drive. But, COVID has, in a strange way, brought my staff together, and we are so cohesive now, more so than we've ever been. And it's all hands on deck type of approach. And so we all are generating ideas and coming to the table, trying to make the process better for our clinic and for stakeholders. So, it's an all hands on deck approach for us. Yep.
I'm so jealous of your drive time. I wish I had drive time. Man, could I use a 30-minute commute? It would really, I feel like I'm missing that big time. Well, Stephanie, there's another question, unless you wanted to tackle that one. There's another question. Any advice or strategies on data collection in this time to help quantify the impact COVID-19 is having on your patients? So how might we conceptualize the need within our own patient pool, much less the increased need in our communities? How would we think about the need as well as our impact on them?
Sure. Well, let me jump back to the prior question briefly. Okay. I totally agree with Linda that while I love to try to find time to think strategically, my staff is equally, very cohesive, and we're so unified in wanting to help our patients get through this crisis when we can't physically be next to them as much as we would like. And so it's from that need and that heavy weight on our heart, what can we do, that is driving some of these strategic decisions, and it was just regular communication, calling our patients, how are you doing? How are you feeling? Oh, you don't have food. Let me get that for you, or let me help you. Let me give you access to that. So some of that drive to do something to help them through this is illuminating or unveiling strategic priorities and strategic directions. So I echo what Linda said, get your team together, start brainstorming on different ways you can serve your patients and stay connected. In terms of the data collection, it is tricky. We use Care Message for texting, which I bet several clinics do as well. We want to have a survey with telehealth, a patient survey, and begin to capture some of that data. And so we have decided that we're going to do it via Care Message. So our patients that have the telehealth appointment text out a survey, begin to capture the data so we can refine it and improve upon it about what that patient experience is like. Do they think of it just like an inpatient appointment or things like that? But I think everybody has had to shift. I'm sure everybody has done data collection of one form or another, but how can you pivot quickly to capture the needs of our patients during COVID is a radical shift. So
yeah, I wonder about just even qualitative, just to be able to tell a story about someone who you serve and kind of all the myriad of impacts. Could that be a surrogate for more quantitative that might be harder to conceptualize in a quick? But Linda, any response to that? The advice on data collection in this time to help quantify the impact of COVID-19 on patients?
Well, it's kind of, it's somewhat minor, but we have created a relationship with our hospital system and being able to participate in what we call the respiratory clinic. The respiratory clinic is managed strictly by the hospital system, but because of my relationship my medical director has with the hospital, we can refer patients into that system. And so we've been tracking the number of people that are being sent out for those particular referrals. But then also on a daily basis, we do just, the walk-ins, people rescheduled, that sort of thing. We determine what our capacity is, and then we report out the volume we saw compared to capacity. And then we also ask the patients, and we've been doing this for quite a while, what they would have done if we weren't here. And so at the end of the month, we're able to convert that number to a figure, and then we can say, well, we saved the hospital system X dollars. And so I've got a monthly report that I send out to our community members and stakeholders that has that information in it. So it's just a one-pager.
Yeah, it's an excellent dashboard of impact and something that you're already collecting. That's
Right.
I think we're playing a little catch up in some clinics of just, being caught kind of flat-footed, and hopefully you've been inspired by our wonderful panelists today, Linda and Stephanie, who it sounds like work for two really great clinics, well positioned to utilize COVID-19. There's no COVID-17, COVID-19 to build a increased appreciation and ultimately grow programming, grow impact, meet the needs of the people in our communities, because that's what we're here to do. I want to thank everyone who's been a part of these. Thanks for attending. These are all going to be made available, so we're putting them up onto YouTube and sharing it with the National Association. I think they're going to go, out on the whatever the shared platform is that everybody can access. But if you would like any access to the PowerPoints, to the COVID-19 response workbook, or individual links to our previous topics, please feel free to email me. And once again, I want to thank Linda and Stephanie. Thanks so much for sharing your wisdom with our attendees today. And good luck as you move forward in serving the folks in your communities.
Thanks, Josh.
Thank you, everyone, for coming out. Have a great rest of your day.
Thank you.
Bye-bye.